abscess. If you, no. So you usually find the parasite in the cecum. And so the lesion usually in here, cecum, where the trophozoite feed, divide, and cause the disease. Usually the disease we call, the pathology we call pinhead ulcer. Why? Because it's very tiny ulcer, 1 to 2 millimeters. But under that, there's a huge necrosis. Under this pinhead ulcer, we call flask-shaped ulcer. You see something like this? This is really tiny hole here, but down there, there's some kind of the ulcer just look like flask. You know the flask? แก้ว Okay. Something like this. You see the small pinhead ulcer here. When you just cut the cross section, you see very small hole here, but under that, big one. This is a typical ulcer of amoebiasis. Like that, small hole, but down there is very big necrosis. For immunology, this is protozoa, usually stimulate Th1 or Th2. Th1, so HIR or CMAR get rid of the parasite. CMAR, yeah. So how about the antibody? We know that, there's a circulatory antibody response 1 week after the onset of the symptoms. Then persists up to 10 years. So you just got infected by amoebiasis, cause the symptom by amoebiasis once in your lifetime. If you got colitis, you never ever get amoebic colitis again. If you got liver abscess by amoeba, just once. But not antibody response, not HIR, but CMAR. We use CMAR by using activated macrophage. This activated macrophage will get rid of the trophozoite, the parasite by contact-dependent mechanism, and produce free radical, like free oxygen radical and nitric oxide to kill the parasite. But why we need to know that? Why we need to know about the antibody response? For what? For diagnosis. If a patient got liver abscess, but you need to know the causative agent of the liver abscess because you have to give them antibiotics. But you cannot get the samples because it's very tiny and it's in the liver next to the pericardium. So you need serology. If the first time of the serological testing result come back as a negative, then 2 weeks later, you send it again and it come back as a positive. This is what we call seroconversion from negative to be positive. It means recent infection. It confirmed that this infection caused by E. histolytica. But sometimes if you send it and the titer come back as 1 to 2, and 2 weeks later you send it again and it come back 1 to 164. What does it mean? Positive as well is called phosphorizing of the titer. Positive is mean that you will get it later. Maybe this is may confuse you now, but you will get it later. Read this. Read this. And what I just told you is the general knowledge about serological testing. You can apply for other diseases as well. Seroconversion, phospholysing. Okay. However, if the parasite want to cause the disease in your body, they have to evade the immunity. They have to modulate macrophage, not to kill them. How? They just suppress antigen presenting process by reduce this MHC expression. So there is no antigen presenting process. So less activated macrophage, isn't it? And then less TNF releasing and less free oxygen radical releasing. They can also modulate T cell as well. They reduce T cell proliferation in liver abscess and also shift T cell population. They decrease CD4. CD4 is target specific mechanism, isn't it? So they reduce this CD4, but it increased CD8. CD8 is for the innate immune response. So there are some effector T cell, but it is not very target specific. I think we have some time for a break because I talk very fast. So we have 5 minutes break.